I started my course with prep doctors in January, and I finished the course for NDECC course. And at that time, I registered for both parts, the skills part. The skill part was morning session, and the situational judgment part. And I spent, I would say, around 7+ months of training in prep doctors, Mississauga campus. It's very overwhelming, especially for someone who, as you've mentioned, we were waiting for the criteria. We didn't know the instrument list. It was a lot of guessing at the beginning. But then once things started to clear up, I collected myself together and I had a plan. I allowed myself to be lost. Let's put it that way. So I was not putting a lot of pressure on myself. I was coming to the center, I would sit for the 5 hours, I would try to do even one project. I was not even very, I was not very concerned about timing at the beginning. So the first few months, I was focusing on at least one project. I get myself familiar with the proper way of holding the handpiece, approaching the typodont, sitting on the chair, the basics. I loved work check, by the way. I did find it very unique. First of all, it's private, because in the process, you are stressed out, you are nervous. So having that space with the instructors, it did help me personally. So being in the room, opening up about my weaknesses, something that I couldn't do, I was more comfortable sharing. So the privacy of the work check, something I loved. And then the other thing, the magnifiers, something that I really loved as well. I was able to see every single corner and wall and angle of my preparation. So all of that over the months, it did help to shape my hand. Like these tips and tricks you learn from every single day, the twice a week work check, whatever you learn from the instructors, how to fix complications and all of that. Once time was passing by, I was improving at the second half of the course. And that's what the instructors used to tell us at the beginning in prep doctor. Don't put a lot of stress and pressure on finishing on time and timing yourself from the beginning. Take your time, learn the projects, learn how to fix your work, learn how to find your mistakes, correct them, and then will help you to improve with time. And that's exactly what I followed. I exactly followed what the instructors used to tell me. So the first half of the course, I was, warming up, practicing the projects, and the second half I was speeding up, practicing the speed as well as the sequence. The last 2 months of the course with prep doctors, I was able to finish the project on time, and I was good enough to fix my mistakes and learn from the complications that happen. It's a learning curve. You learn every single day. Every single day of the course matters a lot. So I did my best not to skip any days. I did my best to come on time and leave on time. It helps, it accumulates over time. Situational is one of these, what can I say? It sounds easy, but it's not. Anything new, everyone will freak out about it. The fact that it's new, that newness, to it, it brings that fear to your head. So I remember I was the first cycle as well. So in my head, I was thinking, what if they, where would they have that time to come up with all of this material? I don't think we need something that I have to study, but guess what? It was a lot of material to study. The instructors were working 24/7, I'm not sure, but every single week we had a lecture, right? And it was a long lecture, and they had to present material for us in a very nice way, in a very fast way. The amount of efforts and time and the pressure they went through is something that I really appreciate. During university, we've never had such exams before in which we have to sit in front of someone and act like it, right? So it was the first time I had to go through this. So in my head was, what if I don't speak the right way? What if I get nervous? What if I get shy? I remember Dr. Firsan would do the practice session every Wednesday, and he would start picking, names randomly, and I would hide because I don't want to sit on that chair, right? So I learned how to speak up. I learned how to share my thoughts. So that's something that I've learned, and I will always remain thankful for, because by the end of the course, I completely changed. Also, the other major tip that I've learned from Dr. Marwan is listening, how to listen to your patient. That's a skill we lack because we want to jump into an answer. And that can be a killer point. Like you can lose the whole station because you only had formulated, an answer in your head and you want to give it up. So first thing, you read the question and you need to come up with a brain map. Like without having that guidance, I would have been, lost, randomly thinking about, you have to actually write things down, come up with a small summary while reading the question before the actor comes in. So you know how we have to hit every single point of the question? So how would you do that if you're not highly organized? It's okay to be stressed out, but at least keep your focus, right? So that paper and the pen, it helps you. And I've tried that. I've tried a lot of techniques. So hitting every single point, dealing with the actor in front of you and addressing the problem, the chief complaint, it needs a lot of focus. And you need that practice, you need the mock exams exposure. By the end of the course, I collected myself. I was good. I was not that bad. It's not something that comes without practice. You have to practice. You have to break that shield. You have to break that barrier and come out of your comfort zone. When I walked in the exam center, I told myself, I'll leave this door as a successful / proud individual because I would either pass and that's it, or I would fail and learn from it and come back and fight again. So the package that I did with Prep Doctors, the 7 months, I was given also 3 months of mock exams. The thing is, you might find it funny, but it's very truthful. So I did it in the new centers downstairs, the mock exam, and it's not my usual, seat and my usual lab. So it was like a new place for me. It did add a lot of, not a lot, a bit of more stress for me because this is a new unit now, and that's good because in the exam, you're gonna go there. It's a brand new place. You don't know the setting. It's not the same chair. It's not the same, So all these details has helped. So I did the mock exams. I would say, first of all, the spacing between the participants is very close to the actual exam. Same as the exam timing. Lunchtime was the same. There is a limited number of participants. So you are watching every single thing that you're doing because you can be easily catched, right? Especially in terms of infection control and all of that. I was very committed from an early time because that confidence, it takes time to develop. You cannot just go to the exam and be like, okay, today I am confident. No, you have to practice confidence. So from the first day when I took the course with Prep, I was serious about it. During my preparation, when I come to the center, every single day I acted like it's a mock exam. It's the actual exam, So I would come in, go to my chair, not spend a lot of time talking and all of these distractions, my phone, whatever, I would be very focused on my work. The last 2 months before the exam, the instructors used to tell me, okay, your exam is coming up. Now you have to practice 2 things, sequence and speed. Speed and sequence. So I had that in my head. I did the same projects every single day as I was doing the actual exam. And I was timing myself. I have to finish on time and check my work, then I'm ready to leave. That's the hard skills, the hand skills, the projects, the MOD and all of that. And it's also the soft skills. The soft skills, how to manage your time, how to manage the stress, how to stay strong, how to listen to the patient, how to answer in a professional way. All of these skills, it's two categories. And in Prep Doctor, I've learned both. My nature, I am someone who gets stressed out so easily. So I knew that I would be facing a lot of stress that day. So I couldn't sleep the day before. I wish I tried, but I couldn't sleep the day before. I maybe slept 2-3 hours. I don't remember hardly. I collected myself and I stayed strong. And I went to the exam a bit tired. I practiced that same sequence. So what I used to do filling, prep, filling, prep, the first half of the exam. So during that first 4 hours, I would finish 4 projects. And then when I come back for after lunch, of course, I'm a bit more tired now. So I would do the easier projects. For me was NDECC and provisional. I would do the other 3 projects and I would have like an hour to wrap up my work. During the exam, some complications happened, but I've applied the same techniques that I've learned during work checks and mock exams, and it did work, I guess, and I passed. So you have to divide that day in a way that you would have time to deal with complications and you would have time to check your work. It gives you a peaceful kind of feeling at the end. You cannot just leave without reviewing your work. I come from an area in Palestine where people don't have enough access to dental clinics. So growing up as a child, I remember I was going through a lot of pain, teething and everything, and I had to wait a long time with my siblings to get access to that dental office because we lived in a small refugee areas in Palestine because of the political situation and everything. So that stays in my head. I always wanted to be that doctor to provide that treatment for people who don't really have a lot of access to it. So it's something that developed with me from an early age. I came in 2015. My dad chose that we live here. Like, I never had in my head that I would live in Canada because we're refugees, right? We immigrated from Palestine because of the political situation and everything. So I was working as a dental assistant, and in that environment I used to meet international dentists a lot. I've seen how international dentists are successful. They had beautiful offices, they had beautiful patients' backgrounds, beautiful hand skills. One of these offices I used to work with as a dental assistant. So the owner at that office was the one who introduced the prep doctors. I never knew about the prep doctors before. So he gave me the website, the phone numbers and everything, and I started knowing prep doctor through that international dentist. As a start, you are scared, you don't know how to start, you don't know if you're good enough. The competition is very high. The exam is very competitive. Success rate is not the highest. It's challenging, it's a lot of studying. So AFK is, I would say, the milestone for everything. So plan it well from the beginning. Even if it's a theory exam, it is a stressful exam because it's the first exam. And also university's acceptance was depending on it. And also it requires long hours studying, right? You need to sit tight on that chair for I don't know how many hours doing nothing but studying. At that time, I joined prep doctors and the materials that I got was organized. It covered all the subjects. It was long. I studied for around 7 months for AFK. I still have my booklets. I return back to it from time to time. So it's something that you keep for life as a reference. Passing AFK is such a beautiful, good, motivation for you to keep you strong, to go out even stronger for the rest of the exams. It was a first time pass and I got a high mark. I got 89. I was in my head, I wanted to fight for universities and all. So that's why I put like ACJ and like a bit aside. I was training for universities. So if you can save yourself some time and seek guidance and seek the help and the support from institutions such as prep doctors, then that is the number one important thing that you can do for yourself. So do yourself that favor. I respect others' people's opinion, like some people would like to self-study, home study and all of that. But it is stressful, even if you can study, like coming to an actual centers, meeting others, talking about difficulties and challenges. It helps you to de-stress a bit. It's not just about studying, it's also about having that group of people around you to give you the support, that positive/social friendship network with instructors and with people that you know. It helps you a lot. The actual application and how to submit your documents is another story. Because honestly, a lot of my documents were rejected at the beginning because they wanted the whole degree, they wanted the transcript of marks. Some of my documents were missing, some signatures were not matching, it's just so unfortunate. Also, that's something that I didn't know at that time, that prep doctor would provide guidance on how to submit documents, how to gather your documents, and that can save a lot of time. It took me, I would say, around 1 year to get the approval to start the process. So the first piece of advice I give people, international dentists, gather the documents the right way, get consult from prep doctors, because honestly, you don't want to miss time with that. Like I lost a lot of time doing that. I would highly advise others to consider taking courses for every single exam. First of all, it increases your chances for success. If, God forbid, you fail and you'll be like, oh, I should have joined the center and everything. So at least you save yourself from that blame. I was not prepared for this, to say the least. I was not expecting in my head that the process is this long, this costly, and this challenging. It was way harder than I was expecting and way longer than I was expecting. Whenever I get questions about the process, I tell people that, are you prepared to give this amount of time from your life? It's not like ABCD thing you go through. It's something that involves waiting, it's something that involves financial, commitment. Fighting for the seats for every single exam, that's not something that I've never thought that I will go through. It was draining. Another thing is preparing, studying and finding the good resources, like good materials and good centers, and finding a group of people to stick to and prepare together. The system is a bit complicated. You need someone to tell you how to start, how to prepare. So the first 2 years, I would say, I was kind of lost. I was doing other jobs away from dentistry. And then I pulled myself together and I started the process in 2017. So it took me like 5 years to get to where I am, 5+ years, yeah. But if you look at it, we studied dentistry twice. So we studied dentistry back home for I don't know how many years. And we are studying it now again, all over again. So I know like people are hearing me maybe now and they're going through AFK, ACG, NDECC and all of that, and they're wondering if it's worth it. My answer is yes, it's worth it. You should keep going. Life is already hard enough. Like the exams is already hard enough to put you in that stress. So who else is gonna motivate you if it's not yourself? Who else would give you that support that you need? So don't be hard on yourself. I would go to the lab one day, I'll be like, oh my gosh, my MOD is not working today. Oh my God, I can't do composite filling. I'm not good enough. I had that, voices in my head. But guess what? I was able to fight it back. I was like, okay, I'm learning something new every single day. If it's not working today, then I'll show it to my instructor in my work check, and I will ask and inquire again why it's not, I don't know, my margin is not good. How can I fix it? How can I avoid this, next time? That's what I've learned. So you have to learn how to accept your handwork and your skills and the fact that the process is long and it takes time and you have to be patient, committed, and quiet and calm and happy. All of these mixture, it's not hard to achieve. I worked in a dental office as an assistant and I was so impressed with the amount of skills and knowledge international dentists had. I would always ask, how did you learn this? How did you find a course for this? And I did find that it's easily available in Canada. It's something that once you finish the equivalency process, the sky literally is your limit. Because the amount of courses in cosmetic dentistry, endo, surgery, and all of that is endless. So it opens up a lot of doors once you finish the equivalency process. So in my head, I really had that goal in my head that I want to do this. I love being a dentist. I'm passionate about it. And I will do my best to it. I went through a lot of struggles. ACG was not a piece of cake for me. I did pass ACG for my 3rd time. How would you feel the taste of that success? How beautiful and how good it feels without that previous, you know what I'm saying? That hurt taste. It tastes much better. Whatever failures faces you during this journey, it's something that you should give yourself enough credit for the rest of your life. Because without that failure, maybe you would have not been able to be here today. Maybe you would have not been the same person. So that failure helps to shape you. It helps to prepare you for what's next, because what's next is heavier and stronger. So it needs someone who is as strong to face it. The equivalency process is just the beginning. Someone told me sometimes you don't only enjoy the destination, but also you enjoy the journey, the actual journey for it. Because it's something that will always stay in your head, something that you would always thank yourself for it. So whatever it takes, no regrets, keep going, you'll get there.